Welcome to Break the Needle. I'm your host, Adam Zivo, and I'm here to guide you through Canada's problems with drugs, addiction, and crime. Now, today we'll be chatting about homeless encampments. How dangerous are they? What can be done about them? Should they be cleared for the sake of public safety? One side of the debate views these encampments as benign communities that provide some sense of safety and belonging, while the other side argues that not only are they unsafe for surrounding residents, but dangerous to homeless residents themselves. Here to address the issue is Dr. Sharon Koivu, who has worked as a physician in Ontario for 40 years and has specialized in addiction medicine for 13 of those years. She recently gave testimony to the Ontario Superior Court regarding an important case that permitted the city of Hamilton to clear a homeless encampment that was quite notorious. So, welcome to the show, Sharon.
Hi, thank you for having me.
Now, Sharon, I'm wondering, can you tell us more about the Hamilton court case that you gave testimony in? What was the case about and what was at stake here?
So briefly, the case was there were various people who'd been in a homeless encampment who had been removed from the encampment by officials from the city of Hamilton. And they were putting forth a charter challenge saying, essentially, based on particularly Chapter 7 of the Charter, which addresses life, liberty, and security, that it was a violation of their charter challenge, or charter rights, I should say, to be removed from the encampment. And they were putting that forth as their argument. What was at stake here, I think, is an episode of a question, but I'm going to say what was at stake here was essentially who has access to parks and green space and public space, particularly within a city. And can it be essentially taken over by people, even if they feel that they need this space? Or is this space truly public space that can be shared with the rest of the community? And what does that mean? Both for people wanting to be in an encampment and for the surrounding neighbors.
So, why did you decide to speak up about homeless encampments and testify in this case? What drives you personally and professionally?
Well, to be quite honest, when I was first asked, I thought the easy answer was no, and that it was easier to not be involved. But then I started reflecting on patients that I'd had. I'd had patients that had really truly believed that encampments were desirable places to go. People that had been housed that moved to an encampment behind a pharmacy where there was a lot of diversion taking place so that they could have easy access to diverted drugs. And I had patients who had families in the neighborhood that are in London or Southwestern Ontario that wanted them to live with them, but chose to be in an encampment, thinking of it as a safe, desirable alternative. And the people that I'm specifically thinking about had terrible health outcomes,
Can you,
absolutely terrible.
can you expand more upon the dangers faced by people living in encampments, their health outcomes, and other threats to their personal safety?
Uh, Certainly, the health outcomes, encampments are very dangerous. And I think that I could divide the dangers to sort of infectious dangers, dangers related to problems related to safety, violence, and problems related to drug use and overdose. And very much I want to talk about what I saw were problems related to the elements, so heat and cold. So going to infectious risks. Um, Encampments are not sanitary, or they have a significant lack of sanitation, which means people are at risk to having diseases from contact with feces, contact with blood products that normally you're not exposed to. And even having things like a Johnny on the spot doesn't take away that risk unless they are really sanitized. So we've seen problems with hepatitis A outbreaks, diseases that we don't normally see that are associated with encampments. Rodents become involved in encampments, and we've recently had a very high-profile case of someone dying related to a hantavirus. Gene Hackman's wife died from a
Mhm.
rodent exposure,
No, no,
and
no,
that is
Sharon.
actually one of the types of,
Sharon, I'm going to have to interrupt
viruses
you.
that.
We're
Oh,
going to
sorry.
get more into this when we get back from this break, and we'll go back into this topic at that point. Thank you.
Okay. Thank you.